Stroke Prevention Task Force. It's my pleasure to welcome you to the webinar for today, which is Increasing Physical Activity, including Walking More, presented by Cherie Vodica. We welcome your questions, so please type them into the question box, and Cherie will address your questions at the end of the webinar. I also want to remind you that we have webinars every month, usually on the second Tuesday, but it's always good to check our dates on the website, Start With Your Heart. In June, on June 13th at noon, we will have North Carolina's response to the opioid epidemic, data, policy, and practice, presented by Alan Della Penna. That's again at June 13th at noon. And then on July 11th, we're going to have a webinar on motivational interviewing. And that one, the time is different. It will be at 1. So please note the July webinar on motivational interviewing will be at 1. So thank you again for joining us. We're going to let Cherie jump right in. I want to give her a brief introduction. We're delighted to have her presenting today. She is a member of NCLC, and she currently serves as the Executive Director of the North Carolina Alliance of YMCAs. In this role, Cherie conducts advocacy work for childhood obesity prevention through policy change at the state level and collaborates with the 27 corporate YMCA CEOs across the state to engage in healthier communities initiatives, and we're going to hear more about those. So Cherie, thank you very much. We are eagerly anticipating the webinar. Your lines are muted, so if you have a question, participants, please type it in the question box. So Cherie, I will hand it over to you, and thank you very much.
Great, Annabeth. Thank you so much, and it's good to be here, and thank you for inviting me to present today. I titled this series of slides, Physical Activity, the Wonder Drug, because it was one of the favorite sayings that Thomas Frieden, who was head of the CDC, would say all the time about physical activity and how important it is to our health and well-being and the health of our community. So thanks again for this opportunity. So our objectives today are to kind of look a little bit at the latest data on the health benefits of and the recommendations for physical activity, to talk a little bit about the recommended interventions that will encourage and promote physical activity in our state, and lastly, to discuss strategies that the healthcare team can use with patients to promote increased physical activity. So let's start with the physical activity recommendations. These recommendations have been out for quite some time now, and they consist of these 3 big pieces. One is 150 minutes every week of moderate intensity aerobic activity. So these are for adults, 150 minutes a week. Or 75 minutes of vigorous intensity activity, such as jogging or running. So you spend less time if you up the amps. And then it's also important that people include muscle strengthening activities on 2 or more days a week that will engage all the major muscle groups. And you can see those listed here: legs, back, hips, abdomen, chest, shoulders, and arms. So doing some kind of work that would engage those muscles in strengthening activity. I think the most important message is all adults should avoid inactivity, and I really am going to emphasize that in this presentation. You know, because we have so many people who are completely inactive, and we'll look at that data here in just a few minutes. But some physical activity is better than none, and more is always better. And so so the message here is adults who participate in any amount of physical activity are going to gain some health benefits, but of course the more benefits come from more activity. The other important thing to note is that aerobic activity needs to be performed in episodes of at least 10 minutes in duration, and preferably it should be spread throughout the week. So in other words, while I love getting on my bike for a couple of hours over the weekend and accumulating, and it's not unreasonable to accumulate 120 to 150 minutes all in one fell swoop, that's not really what we're after. What we're after is more regular activity spread throughout the week in at least 10-minute increments. So why do we do this? Well, it reduces our risk for chronic disease. And of course, for this audience, high blood pressure, heart disease, overweight and obesity, stroke, type 2 diabetes, colon and breast cancer. And I would even add to that list depression, stress, anxiety, mental health benefits. There are so many different benefits to engaging in regular physical activity, whether it is moderate intensity or vigorous. And in fact, sitting is now the new smoking. And that's why I said that I was really going to emphasize that some activity is better than no activity, and that extended periods of physical inactivity are dangerous to your health. So, it's important to get that message out there to so many of our North Carolinians who spend most of their time sitting. So it is, there's studies now that demonstrate that the more you sit, the more likely you are to die. And that's what this slide really highlights. The risk of dying prematurely declines as people become more active. And the most dramatic difference is seen in those who are inactive and those with low levels of activity. So you can see on the graph here, your relative risk goes down the more minutes of activity, whether it's moderate or vigorous physical activity, you accumulate in the course of a week. So approximately, and that decrease in risk is about 30%. So it really is a significant change if we can get people moving. And yet, people are not moving. You will see here, this is 2015 Behavioral Risk Factors Surveillance System data that shows the numbers of adults, and this breaks them down by different demographics that participated or actually achieved the Surgeon General's recommendation of 150 minutes or the 75 minutes of vigorous equivalent of physical activity per week. So this is a CDC calculated variable. So you can see that males are not achieving their minutes. A significant number of them are not achieving any minutes, so almost 30%, and then a little over 20% are getting somewhere between 1 and 149, but certainly not meeting the recommendations. They are slightly more active males than females. And then you can see, of course, that our biggest risk factors for sedentary lifestyles fall into the categories where you have Black, African-American. The African-American demographic, you can see, is less likely to achieve that 150 minutes, less education, lower income, all challenging areas for us to be thinking about. So as we're working on this, we want to make sure that we are looking at those factors. So, you can get physical activity all different kinds of ways, whether it's walking. I'm actually using a stand-up desk at work, sit-to-stand desk, and I have one at home as well, because of course most of us have, and many of our people that we talk with day in and day out have sedentary jobs. Certainly having a sedentary job is a risk factor. If you have a more active job, that certainly does help you get more minutes a week of activity. So that's not to be discounted. So I think when we're talking with participants or patients or whomever it is we're dealing with, we need to be asking about their entire lifestyle and what that looks like, because we don't want to discount things like working as a housekeeper and vacuuming, walking from room to room to pick up, clothing, or people who spend a lot of time on their feet walking in restaurants, as food service employees or something like that. So there are many construction work jobs. You think about a lot of jobs that are very active. So it's important to talk about work activity. It's also important to talk about leisure activity. And then certainly for kids, looking at active playtime, looking at how they're getting to school, looking at all the opportunities for them to be moving, because the recommendation for children is that they sit very little. So, and most kids are kind of born that way. They don't want to sit very much. So, and then we also think about how to build our environment and talk about other ways for people to engage in physical activity just by default. It's something that they do whether they intend to or not. So, what's great is that most people, the most common type of activity reported by adults in the 2015 BRFSS is walking. So, encouraging walking seems to be low-hanging fruit, and it's something that anybody can do. You don't need any kind of special equipment. You don't need any kind of a membership to anything. You just can, if you live in a community where walking and biking is safe, you certainly can get out and walk in most places and do that successfully without a whole lot of effort. You can see there that people de-emphasize or don't do a whole lot of the kind of muscle strengthening type of activities that are recommended as well. So it's important, again, to remind people that while walking is great, we still need to remember to do a little bit of that strengthening activity. It doesn't have to be weightlifting, but it does need to be weight-bearing, some kind of weight-bearing exercise to strengthen. So let's talk a little bit about what works and how do we get people moving more in the state of North Carolina. So I want to first point us to North Carolina's obesity prevention plan, which is available on eatsmartmovemorenc.com. This plan lays out a series of strategies that are all evidence-based to support healthy weight and healthy communities in our state. And you can see the settings listed there, healthcare being one of them, childcare, schools, work sites, community-based organizations like YMCAs, local government. So it's really, to use the phrase, it takes a village. It's going to take all of us doing things that are evidence-based strategies to help people learn how to move more. And I specifically wanted to talk about healthcare strategies related to this because I assume that many of you on this webinar are working in the healthcare arena. So, healthcare typically does not necessarily involve talking with people about their communities and their community environments and how safe it is. But I think that might be a conversation we need to start having when patients come in to see practitioners to talk about their health and well-being. It's important to ask questions about where they're able to get activity, because it would be informative for all of us to know a little bit more about how people are getting activity and where they're getting it and what the barriers are. I think we know that there are many community barriers and many other kinds of barriers, although most people will say time is their biggest barrier if you ask them. So you can see here a series of strategies, and the ones that have the green triangle with the running man in them are the ones that are specific for physical activity. But for example, in a hospital or healthcare setting, there can be point of decision prompts used at stairwells, for example, to encourage people to take the stairs up 1 to 2 flights to engage in more physical activity. And that is an evidence-based strategy. We also can promote physical activity for all patients and record their physical activity levels. And I'm going to talk a little bit more, a couple slides down, about physical activity as a vital sign. We can also talk with folks about and offer behavioral counseling and behavioral interventions for adults who are identified as obese or overweight around getting more physical activity. So getting them into a program that encourages them to learn a skill or learn some way of being active that they really enjoy. And that's really also a big important piece of this, is finding something that you enjoy that you can sustain throughout your lifestyle or throughout your lifetime. And certainly being good role models is important, and I'll point to that one, which is the third strategy down, practicing our own healthy lifestyle behaviors and being role models for our patients and participants, and being engaged in community coalitions to make our entire community healthier. So when I talk about making our communities healthier and being able to walk in our communities safely and just strap on a pair of shoes and run out the door, research shows that if you have destinations that are within a half mile, more people will walk. And so, if my church is a half mile away or if the grocery store is a half mile away, I might not hesitate to walk up to the store to pick up some milk versus drive my car. Public transportation is another important factor in looking at how active people are going to be. Public transportation by default adds another 20 minutes a day, 21 minutes a day of walking. So you're walking to the bus stop, you're walking away from the bus stop to your destination, and vice versa. And again, it's that physical activity by default that you do as a part of your normal course of your day that we don't want to discount and we certainly want to encourage. And then certainly more access to green environments has been shown to really increase walking. So the more we have parks, engaging places for people to walk that is away from traffic, or at least there's a barrier or some kind of at least just a distance between quickly moving traffic and the sidewalk, for example. So certainly when we have more parks and have more signage that helps people find where they are and where they're going, and then doing outreach activities to help people increase their use of parks and increase their use of greenways, we certainly see an increase in physical activity. So the Surgeon General a couple years ago, I think it's been 2 years ago now, came out with, in fact, the date might be on there, but I don't see it. The Surgeon General's call to action to promote walking and walkability was released. And that Surgeon General's report really called on us as Americans to increase walking by working together to make walking safe, convenient, accessible, and to really create a culture that supports walking for all of us and all of the abilities. And so I've put the hyperlink to that report if you've not seen that. But there's a whole series of campaign materials that are there to support the Surgeon General's call to action to promote walking and walkability. And certainly here in North Carolina, through Eat Smart, Move More North Carolina, we have developed a series of advertisements to help promote walking and walkability. And so you can see those ads here on your screen. They are free and accessible to you and to anyone across the state who wants to use them. You can go to eatsmartmovemore.com and download these materials and put them in church bulletins, put them, hang the signage in waiting rooms, post them in your community centers, wherever you might be, that would encourage people to walk more. And these ads feature messaging that was tested. That so when these messages were tested, what the testers found was that people are more likely to walk when you really talk about being able to build stronger relationships and human connections by walking with others. So you'll hear stories about moms saying, gosh, the only time my teenager really tells me fully about her day is when we take a walk after dinner. Or you may hear husbands and wives say that, the time we really have to talk to each other about the important things in our lives is when we're out for a walk. So this connecting as human beings and walking at the same time is something that is really critical to the success of this campaign, and that's what people told the message developers when they were doing the work to build this. So these ads support the Surgeon General's call to action. If you are with an organization that likes to co-brand things, you certainly can add your logo to these materials. They are available in English and Spanish, and you can see there that the formats are in print, billboard, internet, TV, and radio. So we've got all the bases covered. And here's another picture, and this one actually shows a co-branded situation where this organization, Transforming Health Together, co-branded with Eat Smart, Move More North Carolina to put this ad up. So I want to talk a little bit about, too, what the YMCA is doing and what we're working on to help promote walking and walkability. So for the last 2 years, the the YMCAs all across the nation have had a little bit of funding, and I mean a little bit of funding. About $4,000 comes to North Carolina for this work. But what we've been doing is really working with our partners in public health and the Department of Transportation and other groups to identify ways that we can really make a difference in the community environment to help people walk and move more. And so one of the things that we've done this year with our CDC walkability funding is provided some funding to the public health regions across the state that are working on active routes to school. And so that funding is being used to repaint sidewalk or repaint crosswalks and to paint other signage on streetscapes so that people can feel safer and identify where it is safe to walk and where it is safe to cross, especially busy intersections near schools and in the communities surrounding schools, which will then in turn encourage families to allow their children to walk to school. Because again, one of the biggest barriers to walking to school, even if families live within a mile of school, the biggest barrier is safety and a little bit of stranger danger. We also worked on trying to, and we did, amend the statute, the North Carolina General Statutes around open use. And so open use is a concept about how school properties are used. And historically in North Carolina, we've kind of had a don't ask, don't tell policy around using school property for public use. So for example, it's not really been specified in statute that you could or you couldn't go take your children to a school playground after school, for example, for them to play and get some activity, or for you as adults to go walk around the school track. So what we did was we worked with the legislators in the North Carolina General Assembly to add some language, and we worked with the North Carolina School Boards Association, who was very helpful in helping get this done, to revise 115C-524 to make sure that school districts felt comfortable with the liability situations that they often feel prevent them from opening their school property for public use. So that, that statute did get changed, and we also created a toolkit for promoting open use of school property in North Carolina. So this is, you know, providing families with a destination to walk to, and then an opportunity for them to use this open space in their communities is a really great opportunity for increasing walking and other forms of physical activity in our community. So I would encourage you to check out that open use toolkit. It is available on the Eat Smart Move More North Carolina website. So all of this kind of comes down to making physical activity the easy choice. And again, I'll just promote or talk a little bit more about, you know, that we talk to patients, especially in a clinical setting, about their physical activity levels. And then I wanted to mention this exercise as a vital sign. It's really critical that as practitioners working in healthcare settings that we ask questions about people's physical activity and then recording that as another vital sign. And there's a whole effort out there called Exercise is Medicine that, again, identifies physical inactivity as one of the greatest public health challenges, and then provide some resources for providers on how to have that conversation and to document that important vital sign in medical records. So with that, I'm going to close and open it up for questions. And I see Annabeth has asked to explain how to access the free walking ads. So the walking ads are available on eatsmartmovemorennc.com, and if you go to on the website, there's actually a page off the main page, off the home page, that says ads. And I believe that is where they are housed, if I'm not mistaken. Are there any other questions?
Yeah, everyone feel free to type into the chat box or the question box, and Cherie can see your question and answer it. And if you have any examples, you know, of things that you're doing in your communities or any tips that you have found that help you when you're talking to your clients or patients? We'd be particularly interested in hearing about that. I know a lot of research points to the impact that providers have when they talk to their patients about getting more physical activity. Patients tend to really hear that when their providers talk to them about how important it is.
Yeah, that's very true, Annabeth, and I think probably some of the most critical messengers for that can be physicians and other healthcare providers in that clinical setting, because again, there's a lot of credibility there, and I think we also can use providers' voices in the advocacy realm as well. Again, asking questions about what are the barriers to being able to walk in your community, and having people say, well, gosh, you know, gang violence is a problem in my community, or gosh, there aren't any street lights, so walking at night when I get home in the winter time is really difficult. So, you know, just those kinds of things can be really helpful to us in helping to build the case for advocacy for walkable, bikeable communities.
And Cherie, would you also, speaking of safe places to get more physical activity, would you just say a word or two about what you're doing with WISE these days, and how people might take advantage of an organization like a YMCA for increasing activity with their family?
Sure. Well, you know, the YMCA is kind of an obvious choice, and the great thing about the Y, of course, is that we appeal to the entire family. So we have obviously sports leagues for children, teach them how to be active and to really enjoy their physical activity, and certainly we have wellness floors where adults can go in and do cardio and weights and that sort of thing. And, you know, I would say that the Ys are really moving outside the doors of the Y to try to help engage and address the health equity issue and make sure that everybody has access to physical activity, which is a large part of why we're involved in the walkability of the community with the CDC funding, is really strengthening the health of the entire community, not just the people who walk in the door of the Y. So, and I also will dispel this myth, and that is that the Y is only for people who can afford it. The Y will do everything they can to accommodate people if they do not have the funds or the means to join the Y. The Y is a nonprofit charitable organization that does often offer, they always offer sliding scale memberships for folks who do not have the ability to fully afford a membership. So I just want to make that perfectly clear. And would just encourage you to check that out in your community if that's a resource that's there in your community. We're not in every community, unfortunately, but we're in many communities across the state.
That's great to know, because I think you're right. I think sometimes people can throw up barriers before they check it out and, you know, find out what's truly affordable or available to them. And not just in communities with WISE, but, you know, with all other kinds of resources to help you with eating better, including cooperative extension, or getting more physical activity, or walking groups, you know, getting together with other people so that it's a more of a social time if it's hard for you, you know, to get to a gym. And to find out, you know, what kind of childcare is provided, for example, so, or family activities that can be done together so that, you know, you can increase your physical activity and be with your family. So great. Well, we've got just a minute left, and I don't see any questions. So any parting words of wisdom for us, Cherie?
Let's all go move.
Let's all go move. I know I stood up as you were speaking about being at your standing desk. So let's all go take a walk now, and you know, even if you do it at 10 minutes at the time until you build up your stamina and your endurance, you know, do walk and encourage your patients and folks that you work with in the community to walk. It's really, really important for us. So thank you everyone so much. And Cherie, thank you very much. That was really interesting and helpful. And thank you for all the resources that you shared. Go to Eat Smart, Move More, North Carolina. They have incredible resources and tips and helps for you to feel supported. So thank you so much, Sheree, and we're recording this webinar and we'll post it on Start With Your Heart so you can refer other folks to it. So thanks everyone and have a good afternoon.
Thanks, Annabeth. Bye-bye.
Thank you.